for your attendance of the October meeting of the Secretaries Science Advisory Board. Appreciate the efforts of Franny Nielsen to craft the agenda, working with the staff of the secretaries to make that happen, and then also Peter Johnston for the logistics of getting us together virtually. It is good to be able to pivot virtually. We have board members that are attending from as far away as Charlotte, Brunswick County, and Greenville, or in the case of Jamie, actually traveling across the country today. And mostly what we have to do today is presentations as opposed to other action items. I'll just say that I received regrets for attendance from Doctors Annette Viney in Asia, Dave Dorman, and Detlef Knappe. Detlef will be able to join for the afternoon session, but not the morning. All three of those folks have teaching obligations this semester that coincided with our time together today. I'll also mention that Jamie DeWitt has a new job since the last time that this board met. Jamie's been named the new director of the Environmental Health Sciences Center at Oregon State University's College of Agricultural Sciences. She starts that new job in November and is in October and is in the process of actually moving. She plans to continue her work on the board with us virtually and maintain some connections to students and research at East Carolina University. And because of her expertise in PFAS, which is a topic of high importance in North Carolina, we appreciate her willingness to continue serving and her making the time for that. And her continued service is not just offered by her, but at the request of both of the secretaries who were consulted upon about her virtual participation. So Jamie, I know you told me you'd be moving across the country. If you're able to join us and want to say something about the new job, the floor is yours.
Thank you. I'm going to leave my video off because I'm in a hotel room filled with two angry cats. But thank you, Tom, and thank you for that really nice introduction to my new position. I'm really excited. I'm sad to leave North Carolina, and I'm sad to leave East Carolina University, but this is just a really great opportunity to grow environmental health science research, especially among junior faculty. And I'll be joining a department of toxicology, so I'll be surrounded by my people, and I won't have to teach pharmacology ever again, which also makes me quite happy. But I plan on continuing my work with PFAS that are of concern to North Carolina, and I plan on maintaining as many of my North Carolina connections as I can, and really appreciate that you all trust me to continue with my dedication to all things PFAS and other toxic things in North Carolina. So thank you for that opportunity to say a few things, Tom.
Of course, and safe travels across the country, and we look forward to your continued participation on the board. I guess I'll pause before I move on to the next agenda item, which is to review and approve the agenda and see if there's any other board members with any news or changes that they want to share since the last time that we met in early August. All right. Well, hearing none, our first item on the agenda is to review and approve the draft agenda and adopt it. That was distributed last week. It's a combination of presentations around a new topic. I've not received any notices of changes. I'll ask before we approve it whether or not Franny or the staff from the secretary's offices have heard of any changes to the draft as proposed.
Tom, the only change we have is where the public listening session is taking place. We were having some technical issues in the ground floor hearing room, and so we've moved the public listening space to the Morrow Mountain Conference Room, and so that information is highlighted on the agenda, but that's the only change.
Okay. Um, then with that, um, would be appropriate to entertain a motion to adopt the agenda with the modification of where the listening session is going to be.
So moved. This is John Vandenberg.
Thank you, John. Do we have a second?
Second,
Thank you. I know that's Tom Starr. Good morning.
it is. Yep, good morning.
And I think it's our practice when we do these virtually to have a roll call vote because it's too hard to see hands. So I'm just going to run through the roll call. Jamie, yea or nay on the motion to approve the minutes? I'm sorry, the agenda as proposed.
I approve.
Rich, did you leave? Gina,
Yes.
thank you. Good morning. John Vandenberg,
Yes, approved.
thank you. Good morning. Betsy,
Yes.
I see you, but I didn't hear you.
Oh, can you hear me? I said yes.
I can now. Thank you.
Okay.
Problem of mind, I guess.
Okay.
Good morning. Thank you. David Howard,
Approve.
thank you. Good morning.
Morning.
Tom Starr,
Aye.
thank you. Morning, Tom. And Elena Kenyon.
Yes.
Great. Well, minutes, I'm sorry, the agenda is approved unanimously from those in attendance. And with that, I'll move us on to the ethics statement. If that could be posted, I'll call it up and read it as well. So I'll just read through it and then we'll pause for a second. In accordance with the State Government Ethics Act, it's the duty of every board member to avoid both conflicts of interest and the appearances of conflict. If any board member has any known conflict of interest or is aware of facts that might create the appearances of such conflict, with respect to any matters coming before the board today, please identify the conflict or the facts that might create the appearances of a conflict to ensure that any appropriate participation in that matter may be avoided. If at any time any new matter raises a conflict during the meeting, please be sure to identify it at that time. So I'll pause and see if there's any feedback from the board on conflicts or the potential appearances of such.
This is Jamie. I think most know that I receive state and federal funding to study the toxicity of PFAS, and I do serve as a plaintiff's expert witness in cases involving PFAS.
Thank you. Any others? Great. Before we move on to the only other action item before presentations and updates from the departments, which will be approval of the minutes, I'm going to pause and see if we know about anybody who's requested to speak. We typically have the request to speak at the end of the meeting, but if there is somebody who's signed up for a particular topic, we could at least consider weaving that in a little bit earlier. So is there anyone who has availed themselves of the link to sign up to speak?
No one has signed up that I know of.
All right, thank you. That was a recommendation from Dr. Vandenberg that we try to match up the interest of speakers with the timeliness of topics in the agenda when we can. So thanks, John, for that recommendation. With that, I'm going to move us on then with alacrity to agenda item 5, approval of the minutes from the August meeting. Dr. Tilson served as the acting chair for that meeting, very much appreciated. The draft minutes were circulated by me last week, and I have not received any suggestions for edits. But I will open the floor to see if there are any questions or edits before I move any further with the approval of those. All right. Well, thanks so much to staff for preparing the minutes. Hearing no changes from the draft that was submitted last week, I'd entertain a motion to approve them as drafted to become final.
So
I'm happy to
moved.
make that. I'll make the motion, and then it sounded like somebody else was jumping in who could second it. I think Dr. Starr.
Dr.
Second.
Starr, second. Thank you. Well, thank you, Betsy, again for chairing the meeting and for making the motion to adopt the minutes as drafted. That's super helpful since you were there and I wasn't. And then also Tom for the second of the motion. I will run us through our roster again for a vote on whether to approve the minutes as adopted. Jamie,
Yes.
Gina,
Yeah.
John,
Yes, approve.
Betsy,
Yes.
David Howard,
Approve.
Tom Starr,
Yes.
Elena,
Yes.
and I'll go back and see if Rich has been able to join. Rich to Julia. I knew that we were missing several of our academicians because of teaching engagements. Perhaps that's the case with Rich. I'll follow up on that. All right, very good. Well, that is approved, and we will move the minutes from draft to final and post them on the board's website. That moves us to the next part of the agenda, which is DEQ and DHHS updates. And for DEQ, who will be addressing the board today?
Good morning. This is Sushma Mace-Moore, Assistant Secretary for Environment. I'll be addressing the board today.
Thanks so much.
Thank you again for giving us the opportunity to contribute to this upfront report. I wanted to start out with the same updates that we've been giving, as this is a priority matter to the department and the state. So I wanted to start out with where we are on the PFAS action strategy for the department. Again, this is a whole of department approach that we're following related to protecting our communities, protecting our drinking water, and cleaning up any existing contamination that we find. Related to protecting communities, we talked about the ongoing sampling and testing of public water systems in preparation for EPA's drinking water regulation that we now anticipate perhaps at the end of the year, early part of next year, would be finalized. Later today, you're going to be hearing from Rebecca Sadowski, who's leading this effort on what we are seeing, how many samples or sites have been tested and what the results are. So that would be presented at the end of our agenda today. In addition to that, we talked a little bit in the last meeting about federal funding for emerging contaminants that are contained in the BIL, the Bipartisan Infrastructure Law. This particular funding distribution is managed and overseen by our Division of Water Infrastructure. And in the last few months, they have released a plan and communications as to how the $61.7 billion in federal funding for addressing contaminants for small and disadvantaged communities would be distributed. And there's an additional 44 million in drinking water systems, as well as about 5 million for wastewater systems under the state revolving fund for both of those types of systems. So right now we have communicated the availability of these funds to the drinking water systems and are anticipating applications to roll in starting this month. So depending on how things go, we anticipate awarding planning grants, engineering design, as well as construction for treatment systems as requested and approved. In addition, last month, I talked a little bit about the Division of Waste Management's pilot program under the Bernard Allen Emergency Drinking Water Fund. This fund has been utilized by the division for testing private wells. We have been using the concept and the funding to look at PFAS contamination. And as a result, the pilot program has been designed to provide not only the testing, but treatment systems for eligible residents with PFAS contamination that meet or exceed a health advisory level beyond those that for which a responsible party is known. Again, this is mainly focused where a lot of our private well testing data are available for us to assess where the non-commerce related contamination consent order trigger is not occurring. We're looking at approximately 600 or so wells that we provided letters for the availability of this pilot program funds. And so far, it looks like about 9 applications have been received. Our team in the Division of Water Waste Management, led by Michael Scott, who's here, are continuing to spread the word and inform the residents for this option for getting their waters treated or filtered. In addition, I wanted to just update that in the coming months, the department, along with our Division of Waste Management and the Water Resources Division, will be bringing forth the next steps to our standards development work related to PFAS. Again, this is the regulations associated with establishing surface water quality standards as well as groundwater quality standards for those PFAS where we have appropriate health and environment data. And then finally, I wanted to acknowledge the receipt of the August 24th letter that I received, as well as Dr. Osberger received from CFPUA's Executive Director, Mr. Ken Waldrop. He's here to provide a background on the letter. We received that letter. We have reviewed that letter very carefully. We understand the importance and the urgency requested in this letter. The department has met with our leadership as well as our technical staff on multiple occasions. And we have, as a result of those discussions, have helped design this today's agenda associated with this particular ask that Mr. Wodrup has provided. We see this as an ongoing complementary activity associated with how we're addressing PFAS. This particular PFAS that he's asked for, which is PFPRA, to be considered as part of a priority PFAS for additional study. And Mr. Waldrop has also highlighted PFMOAA as a continued a chemical of interest for their operating system. We at the department are evaluating this request and are incorporating that in our monitoring, as well as some of the standards work that I mentioned earlier. So we are open to your ideas and working with the chair on the next steps associated with this request. Our main goal today is to ensure that background and a level set knowledge is established across this audience, and then we can address the possible next steps associated with the departments that can be taken. So with that, I'm going to pause on the emerging contaminants update. I did want to follow up on another quick update, which was related to our climate pollution reduction program. This is a grant that EPA has provided to every state in the nation under the IRA, the Inflation Reduction Act. Just wanted to give everyone a heads up that our divisions will be presenting the approach through workshops and webinars in the coming month, and those dates and the locations are now available. We will be having that on our website, and there'll be some announcement going out. We will, in a few moments, I'll put that in the chat box, or reach out to me or Franny, and we'll get you to the right people in our technical team. So with that, Dr. Augsburger, thank you for the opportunity to give a report.
Thanks very much, Assistant Secretary Mace-Moore. Are there any questions from members of the board? We appreciate the update. It does set the stage nicely. Thank you for the presentations this afternoon for the main topic of the perfluoropropionic acid updates. And I appreciate the fact that the minutes usually contain all of this information in detail for future reference. We'll move along then to hear from the staff of the other secretary that we serve in DHHS. We're oftentimes joined by state epidemiologist Zach Moore or branch head of occupational or environmental epidemiology, Virginia Guidry. Who is it that we'll hear from today?
Good morning. This is Virginia Guidry. I'm here to represent for DHHS today.
Great. Thanks for being here.
Sure. So hello, everyone. Again, Virginia Guidry, head of the Occupational and Environmental Epidemiology branch at DHHS. Zach Moore is at a leadership retreat today, so he's unable to join and sends his regrets. So just some quick updates from DHHS. I will start with a quick update on our respiratory virus season, which we are in. And I'm going to attempt to share my screen and just kind of show you our, hold on one sec. Okay, I'm actually not going to share my screen. I'll just give you verbal updates on our respiratory virus season. So basically we saw, and many of you probably experienced, friends and family with COVID here in summer and late summer. We have seen an increase in our wastewater surveillance as well as emergency department visits and hospitalizations. However, those are coming down a bit. And what we are expecting is that we will continue to see a decrease for a little while here in the fall, and then we will start to see an increase again as we get into later fall and winter seasons. So all of that is just to say, please go out and get your reformulated COVID vaccine and the flu vaccine as soon as you're able to help protect friends and family from COVID and flu this fall. Regarding other updates from DHHS, I'll just touch on a couple. I mentioned our wastewater surveillance data is helping to track our respiratory viruses, and we are continuing to use that for both COVID, flu, and RSV. We are also continuing to expand our capacity at the state lab for wastewater surveillance, including sequencing, because now that is one of the best ways that we have to identify variants of COVID and to track variants of COVID across the state. So we can do that in wastewater as well as in clinical samples. Our climate and health team just submitted the DHHS climate strategy report, which is required annually to Governor Cooper in response to Executive Order 80. And so that details the activities at DHHS to address climate change. And our climate and health team has also recently awarded a climate justice mini grant to organization in Western North Carolina so that they can work on incorporating environmental justice and climate justice into community health assessments completed by local health departments. And that will be supporting 16 local health departments in Western North Carolina with that effort. On environmental justice work, just building on that, we are continuing work statewide to incorporate environmental justice into the community health assessments that I just mentioned, as evidenced by the mini grant, and also continuing our work on the environmental health data dashboard and incorporating data there on environment and health and environmental justice. And then last, I'll just touch on follow up to our fish consumption advisories. We discussed that at length at the last meeting, and discussions continue about that. We've done quite a bit of outreach to share those advisories, and we will be attending on October 25th a fish forum organized by academic partners to discuss more about fish advisories in North Carolina and how they're developed and communicated and work together on continuing to improve that process in our state. So that's the end of the DHHS updates. Thank you for the time.
Thank you, Dr. Guidry. We appreciate it. Are there any questions from board members about the update from NCD HHS? Very good. And thank you as well for the detailed updates that we typically get captured in the written notes for future reference. Those are quite helpful. Well, great. I think that moves us now on to informational items on the agenda. And as you heard from Assistant Secretary Macemore, all of these updates before the break are associated with a new topic that she did a nice job of teeing up. As you heard from Assistant Secretary Macemore, just over a month ago, we received a letter which all of the Science Advisory Board members have now been copied on from Mr. Ken Waldrop with the Cape Fear Public Utility Authority. He's their executive director and will join us next. His letter had the request to add perfluoropropanoic acid, also known as PFPRA, to add that to North Carolina DEQ's priority PFAS list. As you all know, PFAS contamination presents significant water treatment challenges, particularly when it comes to these short chain compounds. And for any of you who've been following this issue with the board over the last couple of years, you'll also recognize that, like the overwhelming majority of PFAS currently being detected in a variety of environmental samples, PFPRA lacks benchmarks such as maximum contaminant levels, health advisory levels, or preliminary health goals. We lack that information formally promulgated that would both help inform treatment goals and provide authoritative information to the public about drinking water quality. So you may recall the board's work on PFMOAA, another short chain compound that is on the state's list of priority PFAS for additional work. The board reviewed the toxicological information for that compound and didn't find it adequate, although recommended that be revisited when new information became available. Earlier, the board in 2017 tackled Gen X, a locally important compound, and found the information adequate to derive a number. So I think what you'll hear today over the next three presentations is that for EFPRA, there is an emerging information base upon which to take further action. You're going to hear that, but you're going to also get exposure information summarized by the state. And we're going to kick it off with an overview of the issue from Mr. Waldrop. Again, the request that's gone to the agency and to the board is to add PFPRA to the priority list of compounds because of the need for information to help guide water treatment and inform the public. Hello, Rich. Nice to have you with us. So with that, Ken, thanks for being here and thanks for your continued interest in science-guided environmental management. The floor is yours.
Thank you very much, Dr. Osberger. I'd like to thank you as chair, thank the board, and thank the staff for the time provided today and for consideration of our request. I do have a brief presentation to tee up the conversation, and with your indulgence, I'll go ahead and share my screen.
Yes, please do. And I'll let you know when we can see it. Looks perfect.
Fantastic. Thank you. I'll begin by reminding the board about CFPUA and who we are. We are one of three relatively large municipal water and wastewater providers in the lower Cape Fear. We are the one that provides most of the drinking water to New Hanover County, all of the city of Wilmington, and all of, or for the most part, Wrightsville Beach and much of New Hanover County. We serve 200,000 individuals, I'll remind you that the other utilities in question that take water from the lower Cape Fear are Brunswick County, who distributes to a number of utilities in Brunswick County and Pender County. We share a common raw water intake source at Lock and Dam number 1 at a location known as Kings Bluff. And above all of our intakes, as this board well knows, there is a history of manufacturing for per and polyfluoroalkyl substances, PFAS, specific to the Fayetteville Works site, owned first by DuPont, now by Chemours, our neighbor upstream, Chemours. And in 2017, it became widely known that there was contamination in the Cape Fear River from the Fayetteville Works site. Numerous PFAS compounds, among them Gen X being the first and most prominent, but others being discovered and considered later on. Again, this contamination is from decades of discharges, both to the air and to the water. In our case, and in the case of our peers, Brunswick County and Pender County, our community, as one, asked their water provider to respond to PFAS, and our response in New Hanover County was to evaluate, to design, and then build a very large granular activated carbon contactor facility. The facility was constructed at our Sweeney water treatment plant. There has been some type of public water supply provided at that location for 142 years. This is the latest and newest innovation at that location. The new facility consists of 8 GAC contactors with a design flow rate of 3,823 gallons per minute. They're 22 by 38 feet, extremely large. The media depth itself is 12 and a half feet, almost 13 feet, with a contact design flow of 20 minutes. This is where we integrated that new facility into our existing water treatment plant. For those that are familiar with water treatment, we bring raw water in from the Cape Fear River. We expose it to ozone, both in the raw format, and then after coagulation and flocculation and superpulsators, we expose the water again to ozone. And from there, our first clarification activity is in the superpulsators themselves. They go through another clarification process in our biologically active granular activated carbon filters. That is the point where we are treating for, among other things, 1,4-dioxane. And then, of course, we had to break the hydraulic grade line of this pre-existing facility and essentially build what is a new water treatment plant and bolt it onto our perfectly good water treatment plant to polish the water coming out of the biological filters. Thereafter, it's the finished water is exposed to ultraviolet radiation, and we do provide additional chemical addition at the end and then distribute to our 200,000 customers. The facility has a 44 million gallon per day capacity. And again, at peak capacity, it takes about 20 minutes of water to flow through these contactors. There's almost 3 million pounds of granular activated media in our facility. We're currently using Calgon Carbon F400 as our sorbent. And since we have 8 contactors, that 3 million pounds is divided among them, and we have approximately 375,000 pounds of GAC per contactor. The cost to replace a filter that has been saturated by PFAS is running somewhere between $600,000 and $700,000 per replacement cycle. Now, I've got a very knowledgeable audience. It's just a reminder that, of course, GAC is effective as an absorbent. We've selected GAC from a portfolio of options to include ion exchange and reverse osmosis. Our neighbors across the river in Brunswick County selected reverse osmosis. We selected GAC for a variety of reasons that we believe are good for us. The facility went online October of last year, and we've had 4 replacement filters. We've replaced filters in 4 contactors so far since the facility went online. That GAC that is spent, that is fully saturated with PFAS, is removed, and it is transported to Calgon Carbon's regeneration facility. The one that we are currently using is in Buffalo, New York. It's placed in a kiln. The PFAS is driven off and then captured and then thermally oxidized. There is some destruction of GAC in that process, approximately 15%. So the supplier refreshes the deficit, and then we receive back our granular activated carbon to put back into service. Now, in this first year, we all recognize that our federal partners have moved forward under the National Primary Drinking Water Standards regulation to propose regulation for 6 types of PFAS. And we would note that we're very pleased that when our facility went online, we were able to and are still able to note that the treatment process is successful. It removes at or near non-detection levels the variety of PFAS that it was designed to remove, and PFAS that we later discovered and uncovered as the science grew. We selected PFMOAA as our benchmark indicator compound to help us decide when a filter was saturated. So we looked at the consent order and saw the triggering event of 10 parts per trillion. We saw that PFMOAA was one of the more difficult to treat indicator compounds from our neighbors upstream, Chemours, and that was our established benchmark. What has changed since we put the facility online? What we have seen is we've seen the science evolve over the 5-6 years from the discovery of this contamination to the facility going online. We're now looking at more than just Gen X. Our indicator compound, PFMOAA, has been traditionally the largest, the most prevalent type of PFAS that we have detected in our raw water. But there are others. And since we put our facility online, a few things have changed. One is in March, EPA proposed those national primary drinking water standards. I will show you how the facility is complying with those standards. And I'm very pleased to say that we're easily meeting the proposed NPDWR standard for PFOA, PFOS, and the hazard index as it's proposed today. But optimization continues for other non-regulated compounds that are coming from our neighbors, Chemours. I'm again dealing with a very knowledgeable audience. Here we have a graphic that our staff used to help us understand the portfolio of testing that is available for the various types of PFAS. As you are well aware, EPA approved standard methods for 29 PFAS compounds. That's a standard method M533, M537.1, and they're in the process of approving M1633. And we have a graphic here that shows from green to blue to teal that differentiation of compounds that are options of testing from various laboratories. We use gel as our gel laboratories as our testing source, like the state. We report the method detection limit. With lacking guidance for any other reporting criteria, we have, as a organization, selected over the last 6 years to report the method detection limit finding that we get from our laboratories. And we hope to get guidance from the board on the appropriateness of that as a reporting threshold as part of this conversation. We would note that there's a number of compounds that have emerged over the last couple of years. The one that we put forward for your consideration, PFPRA, has recently received a change in status to our understanding. That first change of status is our laboratories and our internal quality assurance staff have shared as of April, they have a higher confidence in the data being provided by the laboratory in terms of results for PFPRA. And also note that the National Resource Defense Council conducted a pilot study across 16 states. And that study used the same testing methods, these advanced modified methods that we are using from contract laboratory Eurofins. And as you'll learn, or as you know, GEL will report 65 types of PFAS, Eurofins will report 70. The study found that PFPRA was the most frequently occurring compound in drinking water systems, detected in 24 of 30 samples. It was also the PFAS compound reported at the highest concentration in 15 of the 30 samples. So we now take you to our own reporting. If you go to our website, you'll see that we are reporting all compounds, both finished and raw, and we're reporting at the method detection limit again. If you go to our website, this is what you can see. This is what the public sees. I'd note that our benchmark contaminant, PFM-OAA, well, we have been using that to help guide our exchanges, and we've been exchanging filters. We've been classifying them as saturated if the rolling annual average was going to reach or approach 10 parts per trillion. And if our instantaneous for any of those filters were also 10 parts per trillion. But PFPRA, now that it's come on our radar, and we do believe that our source is the proximate source of the Fayetteville works, there's a lot of data in history that indicates that our particular PFPRA issue is originating from there. We're seeing that in breakthrough, just as we are for PFM-OAA, and we're seeing it at similar levels and even higher levels. So we elected, in an abundance of caution, to increase our filter exchange. We've set 2 thresholds now. We're going to go to a dual trigger of either 10,000 bed volumes, and that's a measure of the efficacy and saturation of a filter is bed volume. And as you may recall, we noted that at full design flow, the water turns over every 20 minutes. So we have 10,000 bed volumes in one of those filters as a trigger, or 10 parts per trillion of PFM-OAA. And that's why we have come to you in the past asking for your guidance on PFM-OAA. And I will conclude by sharing the rolling annual averages for the compounds that we are seeing in the finished water. As you can see, the vast majority of those compounds are at or below 10 parts per trillion as we are reporting them using the method detection limit as the reporting threshold. So we are not using practical quantitation limit or a otherwise established reporting limit. That's some of the guidance we hope to get from you. And you can see why we approached the board and the department to give us some feedback and guidance on this particular type of PFAS. The other thing that has changed is you will later hear from EPA that EPA has established a low confidence reference dose for the first time for this PFAS. So I thank you, and I welcome any questions, or I'm going to stay around for the entire board meeting. You're welcome to ask questions as you have your conversations.
Thank you, Ken. We appreciate you teeing this up for us again today, and for the original letter. I'm glad you'll be staying around for the rest of it, but I will pause now to see if any board members or others have questions of Ken, especially since we're kind of at the understanding the problem stage before a deeper dive into the information on the toxicology of PFPRA, as well as some exposure information. So, questions for Executive Director Waldron?
Text annotation.
Tom, you'll have to say that again. I missed it, please.
Sorry, can you hear me now? Hello?
I can now.
Hello?
Yeah, can hear you now.
All right. All right. And about using the limit as a criterion for duration of your material. How does that come with the capacity of the active car take up? Is it a small fraction of the total capacity or not? Can you hear me?
We can. It's garbled, but I
Can.
think we made it
Hello?
out.
Yes, I think as I understand it, what I think the question was is we're using MDL as our benchmark, and how is that impacting our decision to exchange the carbon? And I think you hit on a very relevant question that we would like some guidance. In absence of guidance, our organization has been as conservative as possible in full transparency to our customers. The PQL is obviously a higher number than the method detection limit. So if we were using PQL as a guidepost for various compounds, you might see that our exchange rates extend a little further. The bad volumes extend a little further. That's kind of the logic. But we haven't even considered that or the impact on operations for that purpose, having no guidance in terms of what was the appropriate trigger for exchange rates. It's a community developed trigger, for lack of a better word, based off of the consent order as the firmest foundation for our business decisions and our health decisions.
Thanks, Tom, for the question, and Ken for the answer. Tom, if you have a follow-up, you might want to just type it in the chat. It's difficult to hear.
Thank you. Just patience here.
Yep, we're patient. Time for a water break.
Perhaps while Tom's typing, I might ask a question. Can you hear me, or is it garbled?
We can hear you just fine, John.
Okay,
Go
thanks.
ahead.
Thank you very much for the presentation. I thought that was very informative, and I appreciate the graphics and the table. Could you just briefly go back to what you started with, I think at the beginning, and you mentioned about 1,4-dioxane. Have you got similar information about 1,4-dioxane in terms of the removal efficiency of the GAC system?
We do have information regarding our treatment facilities removal efficiency. It's my understanding that the GAC facility itself has very little impact on 1,4-dioxane. Instead, it's the biologically active granular activated carbon filters, which were put in place for this and other contaminants, similar contaminants, that are providing the majority of our removal. Although there is other removal in terms of other aspects of the earlier treatment train. And there's a lot of work being done not far from us to maybe improve the efficiency of such filters. We do have a strong concern about 1,4-dioxane. That's a conversation for another day. We'd be glad to come back and tell you everything we think we know about it, including what those concerns are at our facility.
Okay, thank you very much.
Great. And circling back to Tom, I haven't seen your message. Have you been able to enter that into the chat? Or you can try again to ask it. It's just a little garbled on our end.
But then I might add, I would be interested in hearing a similar presentation on 1,4-dioxane and your experience with that, because I think that has become of concern as well. So thank you for that offer.
Other questions while we wait for Tom's to emerge? Again, I'll just emphasize a couple of things. The majority of PFAS fall into this category of a lack of definitive regulatory guidance on a lack of, hang on just a second, Tom, a lack of regulatory guidance definitively on health effects that would therefore be helpful in guiding managers regarding treatment levels. But we are going to pivot from that problem understanding to an overview of the toxicological information that's available, and then some information on exposure, which I think tracks very nicely the state's PFAS action strategy to use EPA's PFAS roadmap to take action, including regulatory action on those PFAS, which are relatively well studied and have foundational values upon which to make science-based decisions, but then also to highlight the PFAS, which are important locally, but which might not be the subject of others' actions for additional follow-up. So Tom, we'll give you another chance to ask your last question. I haven't seen it in the chat, but go ahead and try it verbally.
Okay. I don't know why the audio is garbled. On my end, it looks fine, but I'll try reading this. I would urge the board to consider the merits of using PQL versus M as a criteria filter. It could save a lot of money, and it would be based on real data case assumption.
I did, and can you like cut and paste it and put it into the chat, and then we have it in your actual words, because it is still a bit garbled.
Dr. Osberg, I would note, I would leave you and become a observer, but I would leave you with the thought that we look for guidance. In absence of guidance, we as an organization on behalf of our ratepayers, we take some of the more conservative approaches. So MDL is obviously a conservative way to be reporting data. If we get guidance from our state subject matter experts that it may be more appropriate to use PQL for some or all PFAS that do not have a how or do not have an MCL established, we would incorporate that. But in absence of that guidance, we default to conservatism.
Yeah, understood. And thanks again for the problem setup. We will have a dive into some of the analytical of knowledge of analytical capabilities here in the presentation after this. But the first one's going to be on the toxicological foundation, and either or both can be informative in crafting feedback that's responsive to the requests brought to the board and to the department by Cape Fear Public Utility Authority. So thank you again, Ken, and we're going to move on to the next presentation. As I mentioned earlier, we, in the case of perfluoropropanoic acid, do have the benefit of EPA Office of Research and Development's relatively recent July 2023 human health toxicity value reference dose for that compound. And we're privileged to be joined by a couple of the authors of that today. We have Beth Owens and Lucy Lizarraga, who are both with EPA's Public Health and Environmental Assessment Center. I hope I pronounced your last name right. As an Augsburger, I'm used to hearing mine in all kinds of different ways, but let me know how I did.
Thanks. You did great. I'm going to pass it to Lucy after I give a little bit of the framing of what the invitation. So thank you for
Great.
having us. My name's
Thanks for
Beth
being here.
Owens. And we'll just give a little bit about the assessment that was posted publicly over the summer and hopefully answer questions that folks have about the science. So as you mentioned, we are from the EPA's Office of Research and Development. We did this work under the Health and Environmental Risk Assessment Program. And so Lucy, if you want to move to the next one, we were invited here today to talk about the background of the assessment, the science behind the assessment, and a little bit about that confidence descriptor and its use within the agency. And so to start us off, the request. So what led us to developing this assessment? There was wastewater sampling data around an active manufacturing plant from the years of 2020 and 2021 that showed similar to what we just saw, that PFPRA was one of the highest analytes with concentrations, and that we did not understand the toxicological impacts of those types of levels. And so EPA's Office of Enforcement and Compliance Assurance, or OECA, requested that ORD, or our office, help them to understand the toxicity of this compound. And so they requested technical support, and then this compound was nominated for us to do an assessment. And so in the scoping and the problem formulation stage of our developing of an assessment, we looked at what was publicly available, and then we also looked at what was available to us from industry that was not confidential business information. And so then we thought about the need within the agency was to develop a toxicity value. This would be used for a site-specific evaluation of these chemicals under the Safe Drinking Water Act to support their preliminary water screening of this PFAS around the communities, around this manufacturing site. And so we decided to within the idea that the Office of Research and Development is developing a portfolio of assessment products that are really fit and tailored to the need and the request. We decided to model this assessment after one of our other assessment lines that really is devoted to supporting the Superfund program. And those are the provisional peer-reviewed toxicity values, which others may be familiar with. We felt that the need was, we did not require the review stages that you are familiar with an iris assessment, which some of our other PFAS compounds are being developed under, and those assessments are coming through that program. So we developed this assessment more as a fit for purpose assessment product to address the need within our agency. We then decided that it would be appropriate to post this publicly such that others could rely on this information if they felt that it was appropriate and relevant to their decision context. So that's what led us here and led us to developing this assessment. This is, again, this is 3-carbon short chain compound. And then I'm going to pass it to Lucy, and Lucy's going to walk through how we derived the value, the science behind the value, and just a summary of some of the steps. So hopefully that helps, and I'll pass it to you, Lucy.
Thank you, Beth. Can you hear me okay? Okay, great. So yeah, the following diagram shows the results for the literature search and screen for PFPRA. We used information from an existing PFAS systematic evidence map that was publicly available. And then in addition, we also were able to find unpublished industry studies that were submitted to the agency. All the documentation for this assessment can be found in the Health Assessment Workplace Collaborative, or HAWK page, which I've linked here. And HAWK has visuals, study details, and other information related to the assessment. So I encourage those interested to visit the site. So the information that was compiled from the different databases was reviewed to extract information relevant to human health assessment. And here I've summarized the studies that met our inclusion criteria, and those included 3 human studies, 1 judge medium confidence, and 2 judge low confidence based on study evaluation. These studies examine associations between PFPRA exposure and various health effects, including glycemic indicators, thyroid hormone levels, and semen parameters. Unfortunately, we were not able to identify any reliable effects associated with PFPRA from these studies because they suffer from poor sensitivity. We also identified a 28-day oral gavage study in rats that was overall had a high confidence rating with no significant concerns for potential bias or insensitivity. The 28-day rat study show a constellation of adverse health effects that were consistent with criteria that support liver injury. And those effects included increases in liver weight, liver histopathology, most prominently increased hepatocyte hypertrophy, but also slight evidence of necrosis and increases in various serum biomarkers of liver injury. It's also worth noting that the profile of PFPRA-induced liver effects is consistent with the toxicity, the liver toxicity that is, that we observe after oral exposure to perfluorobutanoic acid, or PFPA, which is a structure-related short-chain PFAS. So given the coherence of the liver effects in the study, these effects were advanced to dose response assessment in order to estimate potential points of departures, or PODs, that are shown here that could be used for the derivation of a toxicity value. Ultimately, liver weight, increases in liver weight in adult male rats were selected for the derivation of the chronic oral reference dose, as illustrated in this next slide. A composite uncertainty factor of 3,000 was applied to the liver weight POD in order to derive the reference dose, which ended up being 5 × 10⁻⁴ milligrams per kilogram per day. The composite uncertainty factor accounts for various areas of uncertainty and variability according to EPA methodology, including animal to human extrapolation, database deficiencies, intrahuman variability, and duration extrapolation uncertainty. In the assessment, we also provided a confidence descriptor for the derived RFD. And this descriptor accounts for confidence in the principal study used in the derivation, confidence in the overall database for this chemical, and also confidence in the quantification of the POD. So for this specific RFD, the confidence was judged to be low, primarily based on database limitations. We had a relatively small database for this chemical that included only 3 human studies and a 28-day rat study. Longer duration studies are needed to fully characterize the potential systemic, reproductive, developmental, or immunotoxicity effects that have been associated with exposure to other PFAS. So to summarize, the Office of Research and Development developed a human health toxicity assessment for this chemical that was modeled after the PPRTB format and process, as Beth mentioned previously. This process involves an internal peer review by 2 EPA scientists, a contract-led independent external peer review, but no public comment period. And we were also able to leverage existing information from a systematic evidence map. In fact, the literature search screening and study evaluation was initially conducted as part of a broader PFAS agency effort. And ultimately, the assessment provides an example for deriving human health toxicity values for site-specific evaluation of chemicals under the Safe Drinking Water Act, and it does not require the full IRIS review process that, for instance, involves a public comment period. So I just want to thank all the people involved in this assessment, and at this point, Beth and I are happy to take any questions.
Thank you so much for the overview, and we appreciate EPA's expertise in deriving the document and your availability today to present it and to field some questions. I'll open it up for questions from the board, and then also the technical staff for the agencies that we work alongside, since we have you available. One of my questions was the document, is very current, July 2023. It mentions the literature search cutoff period of not too long ago. Are there efforts to continue to refresh the literature search and see if there's anything else new, or how does that work in terms of any late-breaking information? Because it's relatively recent, but it's, in the world of PFAS research, things move in a hurry.
Yeah, things move quickly. For the assessment, right now, there's no efforts to continue to look and then update the reference value unless there would be requests within the agency for that, if there was the identification of new studies and a need. So at this time, no. We do within our systematic evidence mapping activity that Lucy did mention, and then that is an evergreen process. So there will be continued literature searches and evaluations through that. And so we will be continuing to maintain that database of PFAS literature as time goes and the evidence increases. But at this time, it would not affect the assessment and unless there was another request within the agency.
I got it. Thank you. And I'll ask one more question, then I'll open it to the floor. In the summary slide of the different sources of uncertainty, where there was a study judged to be high quality that was driving this, but low confidence in the database overall, that resulted in a final determination of low. Is it always the case that like a high, medium, and low ranking of 3 factors results in low overall, or is that a judgment call? Just curious about anything that you can share regarding having high confidence in one study, but then low confidence overall, when it's certainly understandable that the want for corroborating information would be helpful and improve. But on these 3 ranking factors, is it just an automatic with a high, medium, and low ranking that it goes to low overall, or is that a judgment call?
There's a small one. Oh, sorry, go ahead, Lucy.
I just wanted to mention briefly that it is a judgment call. The areas of uncertainty that are, or confidence that are considered, I mentioned previously, is the principal study, the database, and the quantification. It is a judgment call, but I think in this case, because they were severe database limitations, we felt that it was the driver. It had to be the driver for the confidence descriptor for the overall RFD, since we have a very limited database, and our confidence that the value wouldn't change based on the longer studies is low. Basically, that's what the descriptor means. Or do you want to add anything, Beth?
Oh, that was great. Yeah.
Yeah, I get it. The study was high quality. It was a relatively short duration. There's not additional studies to look at, and the short duration of study review helps result in the medium confidence in the final number because of the magnitude of the uncertainty factors that need to be applied for a short-term study like that. Yeah, you've answered it. I didn't know whether it was like an automatic that just goes to the most conservative one of the 3 rankings, or if it was a judgment call. So thank you. All right, questions for the board, for the experts that we have on the line from EPA.
This is John Vandenberg. It's nice to see Lucy and Beth. I used to work with them, so it's very nice to see them. Thank you very much for your presentation. I think if you reflect back on the first presentation by Mr. Walsrode, the units he was using were, I think, either micrograms per liter or parts per million or billion. I can't remember, or trillion. Can you help us convert the milligrams per kilogram per day into units that are more consistent with what he presented?
We wouldn't be able to convert this to a drinking water intake in the same way. That would have to be something that would go through that type of a screening value would have to be derived by maybe the Office of Water or more of the utilities. But so that was something that when we passed this on to OECA, they had to work with the Office of Water to develop those types of screening level values.
And did they do that?
I don't have the screening values, and I don't think that was something that was posted or publicly available.
Okay, you can understand I'm trying to line up what your reference
and what we
with
see.
the values being measured in the environment and the water system. So it would just
Right.
help us to do that alignment. So I appreciate that's not something that you would usually do.
Yeah.
Thank you.
Thanks, Jim.
And it is something that board members and staff could do with a starting point of a reference dose and some of the processes we have about assumptions for intake and body weight. We would be able to make some bounded values there, assuming people thought that that was a useful exercise, given the high quality of one study that happens to be relatively short in duration, but is high quality, which is different than when we faced this issue last time when the board was given a charge to review the toxicological literature for PFMOAA. We did not have any studies that we deemed to be useful in deriving a reference dose for that compound. I understand that that's potentially changing with research from Dr. DeWitt and also research from EPA that's coming out. But at the time, we didn't have it. This I see is slightly different, although there's low confidence overall. There is at least a high quality mammalian dosing study that is bracketed with no effects levels and effects levels with which to derive a variety of points of departure. So there is some information available, and the math part is easily done. But you'd have to get past the first part about, do you concur with the use of a reference dose that's overall rated as low confidence? But thanks for the question, John. Are there other questions from
Beth,
John?
you just said that perhaps OECA has done this. Is that correct? Did you hear me? I'm sorry.
Sorry.
I was
Say
asking
that one more time, John.
I was asking if another part of the EPA has actually taken this forward to develop a value for water systems to consider as a reference, converting the reference dose into a water level for consumption. Has that occurred by anybody, any organization at EPA? I thought I heard you say OECA had done that.
So the OECA had taken this as part of one of their decrees around a community around a manufacturing site. So I believe they use this value to better understand how that community water systems need to be treated. I'm not sure on the availability of the values that they used to make those determinations.
Okay, it would be helpful to know if that's available for us to look at as well.
Well, let's have. I agree. So let's have maybe Beth, if you don't mind, sharing a contact with Franny Nielsen.
Yeah, we can absolutely follow up with Franny after
close that
the
loop.
SAB.
And then Franny can inform the board members on what we learned from that. And maybe that would save us some steps.
Sure.
Okay, thanks so much. Thanks for the question, John.
Yeah. Thanks, John.
Other questions from the board on the toxicological foundations of EPA's 2023 toxicity value? Okay. Well, again, thanks so much for your expertise in putting the document together and for your availability today to go over it and answer questions. Are the slides that you shared with us ones that we can keep for posting?
Yes, and we can also send those to Franny.
That'll be great. That will provide good context for anybody who happens to follow up with the meeting minutes. We'll post a link in the meeting minutes. Thank you again for your time. So we've had the benefit of Ken Waldrop's overview of the problem, compound increasing with time in breakthrough sampling, but without definitive reference values to determine how much is too much in guide treatment. We've gotten some information on the toxicological foundations, relatively recent, on which is half of risk. And now we're going to get some information from Amy Dolinsky with the EQ on environmental occurrence of this compound, the exposure side of risk, as well as analytical capabilities. And this will be the last presentation on this topic before the break. So thanks for joining us, Amy.
Okay, thank you for having me. The topics that we're going to discuss today in this presentation are some background information about PFPRA, and then we'll move into some of the analytical method challenges and some approaches to address some of the challenges with the analysis of this compound. Then we're going to talk some about the considerations with which data we consider to have higher confidence in, and then get into some of the statewide measurement data, as well as then looking more specifically at some of the PFPRA data from the southeast part of the state. So just to orient us, PFPRA is shown here in the red box, and it is a 3-carbon carboxylic acid. It's a fully fluorinated compound, and it's in a homologous series with other fully fluorinated carboxylic acids that we may be more familiar with, particularly the longer chain compounds. The 2 compounds shown here, PFPRA and PFHPA, are a little bit more unique in that Chemours has, I'll just go ahead and briefly say, Chemours has mentioned that these 2 are specifically related to their site. So whereas the other PFAS on this list also have contributions from other sources, these 2 PFAS, in addition to having the contribution from other sources, for example, up and down the Cape Fear River Basin, also have specific inputs from Chemours that are known. And so talking more broadly about the sources of PFPRA globally, PFPRA is found throughout the world as a result of the breakdown of compounds in the atmosphere. And specifically, one known source is the use of replacement refrigerants. So after CFCs, or chlorofluorocarbons, were banned, then there was this increase in PFPRA and some other compounds as a result of the replacement compounds, which are hydrofluorocarbons and hydrochlorofluorocarbons. And the PFPRA, once it's formed in the atmosphere, is then deposited on the land and can subsequently be incorporated into groundwater after rainfall, or into surface water after runoff. The amount of PFPRA is actually expected to increase with time as a result of the use of these replacement refrigerants. PFPRA also can be found in the environment as a result of the breakdown of longer chain PFAS. Certain manufacturing facilities can produce PFPRA associated with some of the process that's happening at the facility, whether it's direct manufacturing or as a byproduct. And Chemours does appear to be the main source of PFPRA in the southeast part of this state, and I'll provide some more data about that. Chemours has provided DEQ with an on-site, off-site assessment, and I have some key points outlined in red that talks, in regards to PFPRA. So early on, Chemours did a non-targeted analysis study using mass spectrometry. And in that study, they weren't looking at the amounts of PFAS. They weren't quantitating PFAS. They were looking at which PFAS are present at the Chemours facility for which there is not an EPA method to do that quantitative assessment. And they found 24 PFAS that had no EPA method available to measure the compounds. So of the 24 PFAS that were identified at Chemours, PFPRA is one of them. This compound was called PPF acid in earlier documents. So this table shows the 2019 early Table 3+ method that was provided by Chemours. And this is their method, and PPF acid, which is PFPRA, is one of the compounds on that method. So Chemours said that PFPRA was associated with their site, and now they've developed a method that includes the compound. However, they did not analyze the compound quantitatively due to analytical issues. I did also want to mention that in the corrective action plan's executive summary, that again, it's stated that PFAS that originate from the site are referred to as Table 3+ PFAS, and PFPRA was one of those compounds that Chemours, again, in the corrective action plan, said does originate from their site. EPA, as part of their research effort, also did some analysis for PFPRA, again, not quantitative work, but just looking at the occurrence of PFPRA. And in the timeframes that are shown here, EPA ORD found PFPRA present in DuPont's effluent, in the Chemours effluent, in Chemours on-site groundwater, and also in the Cape Fear River. There might be other samples out there that have occurred. These are some that I'm aware of. So in terms of the DuPont effluent, up until June of 2012, DuPont used this outfall to the Cape Fear River that is south of the Husk-Locken Dam that is bordering the Chemours facility. Then after that, DuPont and later Chemours used outfall 02, which is north of the Locken Dam, just for orientation purposes. I'm providing here a little bit more information about EPA ORD's non-targeted analysis data that they collected both upstream and downstream and site adjacent to DuPont. And upstream, and I've got a map here that shows around the Fayetteville area are the upstream locations 1 and 2. There's very little or no PFPRA that is detected. I'll mention these values here on the y-axis. They are not concentration because it's not quantitative. These are peak area counts. Higher peak area counts are indicative of higher concentrations, but they are not concentrations in and of themselves. As you get to location 3, which is the DuPont effluent, and then location 4, which is the Husk-Locken Dam, you see elevated concentrations of PFPRA. I shouldn't say concentration, elevated area counts of PFPRA. That then decrease as you move downstream from the facility. So now I'm going to start talking about some of the targeted analytical methods. And these are the methods where we are doing quantitation now of PFPRA. So there have been a number of analytical challenges. One of the main ones is around contamination of lab consumables. And this leads to a high reporting limit for PFPRA. So 2 of the items that cause a lot of contamination are solvents. Certain solvents from certain vendors have PFPRA as a contaminant. And then solid phase extraction cartridges are, they are a consumable that the sample is loaded onto to concentrate the PFAS. It's commonly used in analysis of PFAS, particularly liquid samples, to concentrate down the amount of PFAS in a larger volume into a smaller volume. But these solid phase extraction cartridges have been contaminated with PFAS, and more so from some vendors than from others. PFPRA is also an early eluting compound on the HPLC column. So to have good method performance with HPLC, you need to be able to retain the compound on the column. PFPRA is a compound that has been on the borderline of having whether or not there's enough retention. And for a while, we really haven't had enough retention to really get good analytical results. Over time, in the past several years, more and more labs have been able to achieve better retention on conventional HPLC columns. I'll mention that there are other HPLC columns that can retain it better, but the conventional HPLC columns that are used for the broader longer analyte list of PFAS are now better able to be used for PFPRA retention. I'll also briefly mention that PFPRA, even though it's an early eluter, it is one of the later eluting of those early eluting compounds and has a more potential for better method performance than some of the other early eluting PFAS. One other challenge that we've had is that PFPRA has not had a labeled PFPRA internal standard. So those labeled internal standards can really help to achieve better quantitation of the PFAS. And for the early eluting PFAS, that can be especially important. So some of the strategies that have been used to overcome these issues are to choose vendors whose products aren't contaminated with PFAS. And the labs that do that more have lower quantitation limits and are better able to quantitate PFPRA. You can adjust the HPLC method or use a different column. Most labs are, again, adjusting their existing HPLC method. And this internal standard for PFPRA has been available for almost a year now, I believe. And so labs are starting to purchase that and incorporate it into the method, which should help PFPRA analysis. I wanted to talk about air methods a little bit separately because PFPRA is not directly detected in the air methods, such as OTM 45. The Chemours process chemistry produces acyl fluorides. So that is not PFPRA, but it is the PFPRA precursor. That acyl fluoride will become PFPRA once it is exposed to water, including moisture in the atmosphere. And so I have the actual conversion down here for reference. Also, OTM 45 detects PFAS and compounds that have 4 or more carbons best. PFPRA has 3 carbons, and so it's not really detected very well by OTM 45. There's upcoming methods that might be able to detect PFPRA's acyl fluoride form, which is called PAF. And I've shown it here again. So where are we now with our current analytical capabilities? Contamination is better under control, it's better understood, and it can better be avoided. So I've listed here the quantitation limits in some different labs. Some labs have a quantitation limit of 50 parts per trillion. GEL is the contract lab we use. They have a quantitation limit between 17 and 20 parts per trillion. I'm putting 20 as a round number here to help out. Or you can get even lower quantitation limits than 20, depending on the lab, depending on the consumables and the solvents that are used and the contamination that is hopefully avoided. So the better you can use PFPRA-free lab consumables, the lower quantitation limit and better, the better your analysis. So I've talked already about how PFPRA is better retained on HPLC columns, and we have the internal standard. We've got that error method OTM 50 that's being tested out now for PFPRA, and non-targeted analysis. Again, that qualitative assessment, if you just want identification, that's an option as well. For the data that I'm going to present here from DEQ, we have some certain criteria that we're placing on this data. In order to have good confidence in the data, what we are presenting is any data for samples that are collected and analyzed after April 2023 or early April 2023, because that is when gel labs started having certainty in the limit of quantitation due to a better handle on lab contamination. And that's improved even more since June, but since April, gel was confident in that 20 parts per trillion quantitation limit. So we're going to report and show data that's either after April of this year, or we're going to show earlier results if the sample concentrations were over 1,000 parts per trillion. And there's a specific reason for that. Earlier this year, GEL reported to us that they were having some issues with 400 to 600 parts per trillion in some of their blanks. So PFPR contamination was up that high. So we are presenting data that's at least twice that level of contamination that they were seeing earlier this year for samples that we're reporting data in before April of 2023. Now, I will say that I think a lot of the samples that we did collect were okay, but we don't know that for sure because there was this high level of contamination and there was also some intermittent contamination prior to April. So in terms of statewide data, we'll start off with some of DWR's water data. So DWR has multiple stations around the state, and the one I'm going to focus on is the one at the Huskalakan Dam, which is right near Comores. PFPRA was detected between 1,000 and 1,500 parts per trillion at the Huskalakan Dam in June and in May of 2022. We have some limited data from PFPRA and DWR's groundwater monitoring wells. So the data that we have high confidence in is one value of over 3,000 in New Hanover County and two values that were non-detect in Bertie County. We have other measurements prior to this, but again, we don't have the confidence in that data to present it. DWR also has some public water supply wells that they have sampled across the state. And in 286 samples that were measured, 7 water systems came back with PFPRA above 20 parts per trillion in this year's sampling, the 2023 sampling. So that's frequency of detection of 2.4%. And the PFPRA was found in 5 counties, which is New Hanover, Pender, Cumberland, Carteret, and Franklin counties. Those locations are shown on this map, and that included 3 different river basins, the Cape Fear, the White Oak, and the Tar-Pamlico River Basin. Some of the statewide data we have from the air quality monitoring network are shown here. These are, again, 2023 samples that we have more confidence in. In the wet deposition samples, we have 3 air stations that have detectable limits that we feel confident in. And dry deposition had no PFPRA above the reporting limit. I'm going to show the locations of the 3 air monitoring stations where we had detects. One is in New Hanover County, one is in Pitt County, and one is in Rowan County. Now I'm going to focus more on the Comores site data in the southeast part of the state. So here I'm presenting some data that we have in the Division of Waste Management. In 2021, we had 1 surface water sample that we measured at the Huskalakan Dam, shown here, and the concentration was just over 1,000 parts per trillion. In 2022, we split samples with Comores for on-site groundwater wells, and they were all located on the Comores property. And the range of concentrations for those samples were just over 3,000 to 288,000 parts per trillion. And I'll show that data in more detail on another slide. And then this year we measured the levels of PFPRA in private wells, and that was in 58 private wells. The concentration ranged from below 17 to 128 parts per trillion. And I've got the median detection concentration was 24.8. And frequency of the quantifiable results that we have are about just under half in the private wells compared to almost all of the on-site Chemours wells having quantifiable values of PFPRA. I also should say with these private wells, they were from this year, and so these are private wells farther out from the facility. More likely, it's possible there's some higher concentrations closer to the facility. We're just starting to measure for PFPRA. We have limited data on GAC. So we have 2 residences where we have GAC filtration data, and PFPRA was present both before and after that GAC filter. These particular residences were ones that we had other compounds breaking through in also. But again, we're in the initial stages of measuring for PFPRA, and we'll have more data in the future. So going back to these Chemours on-site monitoring wells, again, all of these wells are on Chemours property, and we have the Chemours attachment C compounds shown in this first group. And what I really wanted to show here is that when you have PF, and PFPRA is highlighted in blue, when you have the table 3 compounds at higher concentrations, PFPRA also is at higher concentrations. So the pattern we have here is, we have this particular well has relatively lower compared to the other wells on this slide, concentrations of table 3 compounds and a relatively lower PFPRA. PFPRA goes up when the table 3 compounds go up. And then when you have the next well that has a little bit lower concentrations, PFPRA correspondingly goes down. And then over here on the far right, when you have even less of the table 3 compounds, you have the lowest PFPRA concentration. Again, just showing a demonstration between the abundance of Chemours compounds and PFPRA. And then lastly, after showing this occurrence data, coming a little bit back to, all right, so where on the Chemours property and in what types of processes at Chemours are responsible for the production of PFPRA? So we have some potential sources of PFPRA. Again, just as a reminder, the process emissions at the Chemours facility produce the acyl fluoride that is then subsequently reacts with water, including moisture in the atmosphere, to become PFPRA. So what comes out of the facility may be the acyl fluoride that's then subsequently converted to PFPRA. So some of the specific processes that may result in PFPRA being formed, possibly through the acyl fluoride, are below. They've been provided by the Division of Air Quality. And so I'll just briefly mention them. The first one is conversion of hexafluoropropylene to the hexafluoropropylene oxide, or HFPO, and other partial oxidation products. The reaction of HFPO in the presence of a catalyst to form an intermediate due to incomplete reaction when forming the acyl fluoride ether in vinyl ethers operations. That would be at the vinyl ethers north and south locations. Thermal degradation of HFPO trimer and tetramer, which are byproducts of the vinyl ethers north reaction of HFPO with itself. The trimer is used to produce E2 for polymerization. And so there's an E2 process area on the Chemours facility that might be an area to look for PFPRA as well. And then lastly, you might have loss of the vinyl ethers either as a direct release or through maintenance or decontamination procedures. And so with that, I will take any questions that you might have.
Thank you so much, Dr. Dolinsky. And I hope folks can see that under Assistant Secretary Macemore's leadership, there has already been a response to the inquiry, the request from Cape Fear Public Utilities Authority to dig deep on this compound and consider adding it to the state's priority list. There's a lot of information summarized here on the history of analytical detection as well as the future detection capabilities. And then we appreciate the screen that was provided to present data for which the department has high quality in terms of statewide detections as well as potentially local sources. So we've made a lot of progress in response to the inquiry from Executive Director Waldrop. And on this aspect of it, I'll open it to the floor for any questions from the board for a couple of minutes before we break. Well, again, it's been the board's practice to rely on a risk-based approach, and environmental risk assessment as a mixture of exposure science and effect science. Thanks so much for the deep dive into the exposure information. We appreciate it. And will these slides also be available?
Yes.
Very good. Well, this was kind of a compulsory circle day to get board members up to speed on what has transpired within the departments since we got the letter from Cape Fear Public Utilities Authority. We've heard a problem statement from Mr. Waldrop. We've heard information on the available toxicological, a relatively recent toxicological synthesis, which resulted in a reference dose, information on effects. Work continues within the departments to dig into a path forward on this, and a charge may be coming to the board. So this foundational material will be seminal for being responsive to that charge. Before we break for lunch, I'll just kick it back to Assistant Secretary Macemore as well as Dr. Guidry and see if you have any closing comments on this morning's session.
Thank you, Chair Osmer. I would just say that we will provide all of these documentations, including the white paper that Mr. Waldrop and his staff developed, the letter in case you may not have the access to that, and then EPA's paper and these presentations. And then we will work with you to develop specific targeted questions for our next gathering with the SAB related to this request.
And Virginia?
I'll just say thank you for the presentations and all the information. We really appreciate the compilation of information on PFPRA. Thank you.
Yeah, I think we've got a good foundation for next steps, some of which are already being taken. But like Assistant Secretary Macemore says, we'll be using this to craft some more specific asks of our science advisors.
Tom,
With that, we're going to pause for lunch and regroup on the last topic, which is be a presentation from Division of Water Resources, Rebecca Sadowski, on the North Carolina Public Water Systems PFAS sampling. We're going to reconvene at 1, and I'm going to pause and ask Peter what the best mechanism is for people to either leave and rejoin or simply put videos and microphones on mute for an hour. What's the best advice?
Probably just put everything on mute for an hour. That's what I'm going to do in here. Pause the recording too.
Thank you for pausing the recording. Do you have the ability to put something on the screen so that anybody who would join knows that we're at a break until 1?
Yes, we will do that.
All right. Well, thanks
Tom?
everybody. I'm
Tom?
sorry, is there something?
Yes, this is Tom Starr, if you can hear me.
I
I
can.
just have one quick question about the proposed reference dose for PPPRA. I wrote down 5 × 10⁻⁴ milligrams per kilogram per day. Is that correct?
You've been given the reference. Let me call it up real quick. The I will open it.
That's what I wrote down too.
Okay, well, just bear with me here. If you multiply that by 70 kilograms, you get 350 milligrams times 10⁻⁴ per day. If you divide it by 2 liters of water a day, that's 2,000 grams, you get 17,500 nanograms per liter as the concentration you would need to consume 2 liters of in order to get at the reference dose. So the reference dose is quite a bit higher than the concentrations that we're talking about away from the Camorra site, but on the same order as the high ones at the Camorra site. So 17,500 nanograms per liter is the equivalent reference dose if an adult consumes 2 liters of water per day. If they weigh 70, yep, it's as simple as that.
It's and we've done that math before for things like Gen X, and
yep,
it'll be useful to have EPA, Beth Owens, who agreed to close the loop with Franny on whether EPA has already done those calculations for maybe the hazardous site assessment work that they referred to as the foundation for their assessment, as well as to have some more discussions on how we would advise the state to proceed on a reference dose for which there's one study of high quality, but an overall indication of low confidence.
Right.
But we appreciate you doing the math on the fly there and offering some perspective in common units.
Yep.
Thanks so much.
You're welcome.
So we are going to rejoin at 1. Please put your phone, your computer on mute and stop your video. And Peter's going to stop the recording and put something on the screen that says we'll be back at 1. Thank you all for your engaging presentation this morning. We appreciate it. When Assistant Secretary Macemore gave her remarks earlier, remember that she provided a little bit of an overview of the state's PFAS action strategy, which kind of maximizes the benefits of EPA's roadmap on PFAS, takes advantage of the things that they're going to do nationwide, but then fills gaps for information that's important locally. I think it's important to keep in mind, kind of that dual strategy, both from the talk that we had this morning about a compound that's locally important for which there's some toxicological data available, as well as continuing to mine emerging information on the occurrence of PFAS that may get attention nationally or the ones that would be important locally. So certainly a related topic is the one we have this afternoon, which is fortunate to be joined by DWR's Rebecca Sadowski from the Public Water section, who's going to talk to us about the 2023 PFAS sampling of North Carolina's public water systems.
Thank you. All right, can everyone see my slides?
The slides are good. Can you make the volume any louder? It's a little quiet on my end.
Sure. All right, how is it now? Any
That's
better?
good. I can hear better, but it's not so loud that it scared the cat. So good job.
Okay, great. All right, so thank you very much for that introduction. As you mentioned, I'm going to be giving an update on our PFAS sampling of North Carolina public water systems. And I'll first touch on the 2023 public water supply section sampling effort, and then I will go into the UCMR 5 data that we have so far. So just a little recap on our sampling effort is we are sampling 655 systems, and we are looking at privately owned community water systems, excluding those owned by Aqua North Carolina and Carolina Water because they're conducting their own sampling efforts, and privately owned schools and daycares. And we are also sampling 3 additional systems that were sampled in previously by the PFAS network as requested by this board. We are conducting 1 round of sampling, and we're taking 1 sample at 1 entry point for each water system and analyzing them for the same 57 PFAS as our 2022 sampling efforts using a modified method 537.1. And we are sending them off to gel laboratories. So far, we have sampled 433 water systems since May, and I just want to acknowledge my staff who have, undertaken this large sampling effort and coordinated the sampling effort and analyzed the data for me. We just got data just a couple of days ago for 286 water systems that were sampled through the end of September. So we have 55 additional systems that are scheduled to be sampled and 65 systems that have declined sampling. This is a voluntary effort, so we do have some water systems that did not want their water system sampled. Of those samples that we have, the 286, 61 systems or 21% had PFOA, PFOS, and or a hazard index above a proposed MCL. So that breaks down into 52 systems or 18% had PFOA greater than 4 parts per trillion. 39 systems or 14% had PFOS greater than 4 parts per trillion, and 15 systems or 5% had a hazard index greater than 1. And that hazard index is driven by PFHXS. They had a ratio of, the PFHXS ratio was greater than 1 in 14 of those systems that exceeded the hazard index. And on a positive note, 80 systems or 28% have all non-detect measurements for any PFAS. And this is just a quick map of the a graph of the 23 analytes that have been detected here in North Carolina from our sampling so far from these primarily smaller water systems. So I've shaded in gray those that have a proposed regulation, and those in white do not have a proposed regulation. So you'll see there's 5 analytes, PFBA, PFHPA, PFPEA, PFHXA, and PFPRA that we're detecting in more than 23% of the samples, but there is no proposed national legislation for those analytes at this time. And just to go back real quickly, I just wanted to point out that our highest sample that we've seen so far is for PFHXS, and that was at 62.9 parts per trillion. And I just wanted to point that out because I know sometimes in the data that Amy was presenting earlier, there were results, over 1,000 for some of these PFAS. So I just wanted to make that point. And into the maps that we have, so I'm just going to break down those results for the proposed regulated contaminants. For PFAS, we have anything that has a green, a yellow, or a red has already been sampled. And so you can kind of get a feel for where those samples are that we're seeing above a proposed MCL. So anything above a proposed MCL or hazard index is colored in red. Anything that's been detected but is not above a proposed MCL is yellow, and then green is non-detect. And the lavender dots are those systems that we have not yet sampled. And I'll break that down. So each of the flower petals is a different contaminant. So one is PFOA, one is PFOS, and one is a hazard index. And I've got those broken out on the next slides. So here's the PFOA slide. So those 52 systems that have a result greater than 4 parts per trillion. So, they're mostly, I did want to point out that we do have the most results here in Wake County because that's where we started our sampling. So it may be skewed a little bit heavily. So I don't want to put too much weight on the fact that we've got, more red there because we still have a lot of sampling left to do. But it is a good indicator that we don't have as much out in the western part of the state so far. So that's PFOA. PFOS, we had 39 systems with a result greater than 4 parts per trillion. Very similar. If I just toggle between these two, the samples are pretty much in the same locations. There's a lot of overlap between a water system. If they've got PFOA, we're also seeing PFOS at greater than 4 parts per trillion. And then the hazard index values, again, we had 15 systems driven by PFHXS with a hazard index greater than 1. So again, just that real brief summary. Now we're on to UCMR 5. And To recap, we have 298 water systems that will be sampling under UCMR 5 between the years 2023 to 2025 here in North Carolina. All systems serving more than 3,300 population will be sampling, and then a nationally representative number serving less than that will be sampling. So we have results for 79 water systems. We just downloaded the data on September 30th. So again, this is very fresh data. For PFAS, we have 24 systems, or 30%, that have a result exceeding a proposed MCL or hazard index. 51 systems, or 65%, have all non-detect measurements for PFAS. So that's definitely higher than our sampling of the smaller water systems. And 17 of the 29 PFAS have not been detected in any of the samples so far. And then, so under UCMR, there's 29 PFAS being looked at, and also lithium. So I put those lithium results in here as well in case folks are interested. There's 15 systems that have, or 19%, that have a lithium detection, and 12 of those systems, or 15%, have a lithium detection result greater than 10 parts per trillion, or parts per billion rather. And the maximum lithium result is 60 parts per billion. And these are the 12 PFAS plus lithium that we have seen so far in those UCMR results. And you'll notice PFBA, PFPEA, and PFHXA, which were on our other detected list from what we are sampling, is also showing up here as being detected in more than 20% of the samples and is not proposed for a federal regulation. And our maximum result here was for Gen X, and the maximum result is 34 parts per trillion. And again, similar maps to what you saw before, again, with red being above a proposed MCL or hazard index, yellow being a detection, and green non-detect. So you'll see that swath kind of central eastern North Carolina, whereas the western portion of North Carolina is showing up as all non-detects so far. We have 10 systems with PFOA greater than 4 parts per trillion, here in the denoted in the red markers. Similarly, we have 14 systems with PFOS concentration greater than 4 parts per trillion. And a hazard index, we only have 2 so far that exceed the ratio of 1, and they're both located south of Fayetteville. And here's the map for lithium in case anyone was interested. So again, those greater than 10 parts per billion are all located, for the most part, on the extreme eastern portion of North Carolina. And they are mostly groundwater systems. We did have one surface water system. And so just a general summary of what we've seen so far, 20% of the privately owned systems have results greater than a proposed MCL or hazard index, whereas 30% of the systems sampled in UCMR 5 have a result greater than a proposed MCL or hazard index. And I don't want to put too much weight into, I mean, it's kind of hard to compare those numbers just because for UCMR, as a reminder, water systems are collecting more than one sample. And to be most conservative, we are just looking at the highest result at this point. Once we have all of the data, we'll be able to do an annual average, which is what EPA has proposed in their regulation. But without all of the data, I don't want to draw those conclusions, so we're taking the more cautious approach. We are seeing some exceedances of the hazard index, and we are definitely finding PFAS other than the 6 proposed regulated contaminants in our sampling results so far. And that is everything. Does anyone have any questions?
Thanks so much, Dr. Sadowski. I'll start with a question. And this may have been in the earlier slides, I just forget. What's the time frame for having the full data set? You gave us the nice images of samples with results in those pending sampling, but when would there be like a full data set to have full summary statistics?
So we should be done by the end of the year. We are on track to meet that deadline. GEL is taking about 4 weeks to get us the data, and then there's a couple of weeks here to do QA/QC and and get that data back out. So first quarter of 2024, we should have the final data set.
Thank you. Questions from any board members or from assembled staff? Detlef, I can see your hand.
I'm curious, are these data finished water for the NCDQ data set, or the the source water, or are you
Yes. All of
tracking
the
both?
data,
Mhm.
all of the data presented today is finished water. We tried to get the best idea for water systems so that they would be able to potentially use this data to qualify for reduced monitoring under the proposed regulations. Once that becomes finalized, if we take one sample as written in the proposed regulations, the water systems could potentially use that sample plus another sample to qualify for reduced monitoring if they had non-detects.
Question, Detlef. Thanks. Do you have a follow-up?
I have a question, Tom Starr.
Thanks, Tom. Go ahead.
Can I ask, do you have a water concentration of PFAS that corresponds to the hazard index equal to 1? Is there a number in terms of a concentration that I can associate that with for some particular PFAS?
So it's actually a formula, and I can go and grab that formula and put it in the chat in just a couple of minutes, but it's a combination of 4 different contaminants. And if I can head back here, I can actually, they'll be in this one.
Well, if you took the most potent one of them in the hazard index and just gave me that concentration, that would be fine.
Okay, sure. So yeah, so it's a ratio of PFH excess over a health number and plus Gen X over the Gen X health number, PFBS, and one of the other contaminants. And once you add those ratios up, then the ratios can't be greater than 1. But yes, I can most definitely provide that information.
All I want is a number for one of the PFAS compounds in relation to the concentration of just one corresponds to the hazard index equal to 1. That is, how much has to be in the water for the hazard index to be equal to 1 for each one of them?
Yes, I think for PFBS, it's 2,000 parts per trillion, which is the highest one. And for Gen X, I believe it's 10. And for PFH and Detlef, thank you, Detlef, for nodding your head. PFH excess, I believe it's 9. And I'm forgetting the 4th contaminant because we don't have it.
So 9 or 10?
Rebecca,
9 or 10?
yeah, Gen X is 10, PFBS is 2,000, PFNA is 10, and PFHXS is 9.
Okay, great, thank you.
Very helpful.
Other questions from members of the board?
Maybe one question related to maybe complementarity with the UCMR 5 effort, since UCMR 5 is not really focusing on systems with less than 3,300 customers, is the DEQ effort filling in a lot of the gaps for those systems?
Yes, we definitely are. We are looking at those privately owned water systems. That is touching on a lot of the systems that are greater than or that are less than 3,300. Most of our municipally owned water systems are larger than that, but we are looking at capturing all of the water systems that will be regulated under the proposed regulation. So we're looking at that now for what water systems we have data for and are collecting now, and then what is that difference and for a possible next sampling effort.
Mm-hmm. And I might have missed it, but for the DEQ effort, how many PFAS are you tracking?
57.
57. So it's also and that includes all 29 UCMR5 compounds.
Yes, it does.
Okay, thank you.
A few more seconds to see if there's other questions from board members or staff. Great.
This is the hazard index calculation, if anyone wants to see it.
Well, thanks very much for the presentation and for your work on this. We appreciate it.
Thanks.
With no more questions, I think that does bring us to the public forum portion of the meeting. But I'll remind folks that they, according to state policy procedures, needed to have signed up to be a speaker. When I checked this morning, there were not any, so I'm going to pause and see if we've had anybody who has signed up to provide comments during the public forum.
Tom, we had some confusion with the building and the public listening space. And so I think perhaps Mr. Waters was here to give a public comment, but ended up in the wrong location. And so we can elevate him to a panelist so he can speak in the public forum in the virtual setting if he does want to make a comment.
Okay. So Mr. Waters, if you're still with us and would like to participate in the public forum, please let us know and we'll move you over to panelists. And I guess, what's the mechanism for him letting us know? Is it the chat?
Is he on here?
We'll just elevate him to a panelist and he can
Mike
tell
Waters.
us yes or no. Mr. Waters, you should be able to unmute.
Yeah, no, I'm fine. I'm fine. I headed back towards Fayetteville and I'm just listening and I appreciate all you guys are doing.
Well, thanks for your attendance today and attention to this issue in long-running fashion. We appreciate it.
I got a text whether others can speak that are not signed up at this moment.
Guess I'll find out what's the pleasure of DEQ and DHHS.
I think that's your decision, Tom. I don't know who else wanted to speak if they weren't signed up. So, for you.
I think we're doing fine on time. If we have one or two that would like to speak, we can make time for that before we close it out. Just have to signify that in the chat somehow.
Okay. So I got a request from Dana Sargent. I don't know whether you can see her on the participant list.
I do not.
I see her here, yeah. I think she's now elevated.
Okay.
Hi, can you folks hear me?
Be quiet.
Can't hear it yet. We'll have to be a little bit louder, please.
Hi, can you hear me now?
I can, thank you.
Okay, I'm so sorry. Thank you, Detlef. I failed to sign up to speak today. I just have a couple comments. I really appreciate all these presentations. I'm trying to keep this brief, but I've written some notes. Amy Dolinsky's presentation was super helpful. I just wanted to comment with concern, especially she mentioned that the current air method is not able to detect PFPRA, and considering Chemours' recent air permit requests relative to their goal to expand PFAS production, we've shared with DEQ our concern about the sampling at the thermal oxidizer being, just for Gen X. We know that it's not, that's a C6. We know there's a lot of these smaller compounds that could be breaking through, and Chemours' air permit request, indicates they're not going to increase air emissions. And so this, her presentation really highlighted the concern that they could very well increase air emissions and we just wouldn't be able to detect them. So I just wanted to thank you all for that presentation and hope that's, something that's really being considered by this group. I also wanted to comment, Thomas Starr and I were having a good chat in the chat, but my capabilities were then removed. So I'd love to talk with you offline. I understand that EPA suggests that assigning the DL to non-detect is too conservative, but I think for our purposes, nothing is too conservative since the non-target analysis showed 257 PFAS coming out of Chemours alone that are like unknown, unaccounted for. We're not measuring. So I think being conservative with those that we are measuring is still not even conservative enough. And that's kind of where where I think, you know, my mindset is, and those down here in the community that is suffering from this contamination. As well, on that reference dose that Dr. Starr mentioned before the end of the prior presentation, with the $17,500 reference dose, or 500, excuse me, NGL reference dose, that doesn't match the math that was done with a different PFAS toxicologist that we worked with. And I think that might be because of the assumptions that are used for other chemicals, not PFAS, in that like what comes in goes out so quickly. And from my understanding from someone much smarter than me, the clearance factor has to be included when we're talking about PFAS. We don't know how these things react in the body. So those were kind of my comments. And I do have one final with Rebecca Sadowski, Dr. Sadowski's presentation. I am really concerned about the fact that that the two Aqua NC and Carolina Water are not being sampled, because we've had a lot of conversations with those folks, and in our communities, the folks that are being served by them are not being communicated with on the PFAS that's in those water systems, those private water utilities, and they're only sampling for at least, I think, 4 PFAS total. So I would really suggest that you look into seeing whether or not you can sample for them as well. You're doing a lot more sampling than, from my understanding, what they're doing, and they're not doing enough. So thanks so much. I really appreciate the time and everything everyone's presented today.
Thanks for your comments. With that, I'm going to move toward closing us out. Again,
Just one quick response, Tom, since my name was
yes, go ahead, Tom. Go ahead, Tom. Tom Starr, if you're trying to speak, we can't hear you, but you do have the floor.
I am connected, so I don't understand why you can't hear me.
Give it another try. We could hear you at the end.
We can hear it periodically. Not getting it. Unfortunately, we have a bad connection, Dr. Starr. We're not getting any of that. But I'll be happy to facilitate a follow-up back and forth if that helps to pursue it, given the technical difficulties there. Well, I hope board members feel better equipped to advise DEQ and DHHS and to work with them. Tom, we're not able to hear any of that. We'll have to, I'll send you an email after this and capture what your feedback is and share it, but we're not able to hear any of it.
Was that nothing is conservative enough.
Again, we'll have to follow up on this when we can actually understand each other, but we are not hearing the feedback. And I will make sure that it happens by email, give you the chance to participate, but it has to be effective for everybody. So I can't see that either.
See it? I give.
So again, from the morning's 3 presentations, I hope board members feel better equipped to work alongside and advise DEQ and DHHS on the inquiry we all received from Cape Fear Public Utilities. You also have the benefit of DEQ staff work to synthesize the exposure data in response to that request from Cape Fear Public Utilities. And you have the benefit of having heard firsthand EPA's synthesis of exposure data for PFPRA, effects data for PFPRA, a relatively recent synthesis of effects data. I hope that it's apparent to others that the work that's gone into being responsive so far to the request to make PFPRA a priority in the state PFAS action strategy is apparent. PFPRA, as we've talked about, like many PFAS compounds, lacks MCLs, action levels, interim guidelines, health advisory levels, but perhaps there's an emerging foundation to be able to pursue that. So today was kind of compulsory circles on the problem, exposure data, effects data, and we'll regroup with the agency leadership to take it the next step upon that foundation. In addition to the EPA RFP document that was shared, we'll make sure that board members receive the primer on PFPRA that was prepared by Cape Fear Public Utilities. I know you have the letter that references that. I'm not sure if we gave you the attachment, so we'll make sure that that happens. In closing, I want to thank the agency leadership, Assistant Secretary Mace-Moore and Dr. Guidry for your agency overviews, to Franny for coordinating the technical content of the meeting and reaching out to all of the presenters. To each of the presenters, Ken Waldrop, EPA's Beth Owens, and Lucy Lizaraga, and also to the in-house expertise of Amy Dolinsky and Rebecca Sadowski. And thanks all of you for your attention today. The next meeting will be in 2 months, and look for a couple of things post-meeting. There'll be the opportunity to review draft minutes, review any of the presentation materials that will be posted online, and at some point revisit a recording. And secondly, I'll make sure to reach out to Dr. Starr so that we can close the loop on what we weren't able to hear because of the problems with that aspect of virtual participation. Any other comments from board members in closing? Or agency staff in closing? Then it would be appropriate to entertain a motion to adjourn.
Move to adjourn.
Thank you, Detlef.
Second, John.
John, all in favor?
Aye.
Aye.
Anyone opposed? All right. Thanks again, everybody, for your participation. We appreciate it. Have a good one.
Thank you.